Hi, I'm Dr. Sam Jacob Cheramil. I head the electrophysiology and I'm a consultant cardiologist at Frontier Lifeline Hospital. I've been here for the last 2 years in this hospital and I have an overall experience of around 7 years in this field.
Hi Doc, how are you doing?
Fine, how are you?
Doing all good. Today we are going to discuss about one of the most hot topics of your subject and where you deal. What is electrophysiology?
So coming to the topic of electrophysiology, it basically handles the electrical system of the heart. So all of us have heard of blocks. When we say a patient has a heart attack or a block, it generally means the blood flow to the heart is low.
Right.
All right. Heart itself has a electrical system of itself. So this electrical system, if there is any variation, it tends to cause a lot of problems. The most common thing being a sudden cardiac death. So you see a lot of youngsters suddenly collapsing and dying. That one of the commonest cause is an electrical problem, something like a sudden cardiac arrest. So this is what electrophysiology is all about. It's the electrical system of the heart that tends to cause you to feel a lot of palpitations, which is your heartbeat either going higher or lower. You tend to feel abnormal heartbeats. That's one of the biggest problems. Or if you have loss of consciousness. And now as the age group in our country is actually going up, as you grow older, there's a chance of stroke because of an electrophysiological problem, something known as atrial fibrillation. So electrophysiology basically looks into all these factors where your heartbeat either goes up, down, and we tend to figure out what and why it's happening and treat it accordingly. I think the biggest example was in Euro 2020 when Christian Eriksen fell on the footballer Christian Eriksen. He just fell on the stadium in the match and he had to be revived. He had an electrophysiological problem for which a device was implanted, and then now he's back to playing football. So EP basically means the electrical system where we look into it and see if there's any other problem.
So how does this EP care matters, and particularly it told about an athlete, right? So for someone of that profession, how do we make sure that they are because their heartbeat varies, so how do we check?
Okay, so any patient who's got any kind of palpitations, that is if they feel that they can feel their heartbeat without much of an exertion, very unusually feel their heartbeat, means they need a electrophysiological checkup just to see if there's something abnormal in that. And any person who's going into a competitive sport requires an EP workup to see if he's got a risk for sudden cardiac death. So it is standard in US and Europe, India not yet, but they do a basic screening at least in the professional level. Probably the initial levels, the school levels or the little higher levels, it is not there. But in Europe and US, it is a standard that every person entering any kind of competitive sport needs to get an EP evaluation. So that is how it works. So any other person who's got any kind of loss of consciousness, any kind of giddiness, all those patients and any kind of palpitations, they require a EP evaluation. Okay. So that's normally the way we go.
Is it very common in terms of people with an old age or something like that? You're mentioning the other day about a patient when she sits up from a lying position or might be standing right after for sleep or a nap. So she gets some sort of that heartbeat or rhythmic problems and all. Is it very common in that age?
So one of the biggest problems in EP is something called as atrial fibrillation. All right. So 20% of the population who's more than 70 years have a risk of developing AF. And what happens in AF is it causes two big problems. One, it tends to lead to heart failure. Second, and probably the more problematic one, is they tend to develop stroke. And stroke meaning your life is kind of very much altered because you're losing some part of your mobility, some part of your life. So it is very, very difficult. So that is where EP comes into picture. So if you can detect the AF early, it is treatable and you can prevent a stroke very, very well. Other than that, as I said, youngsters, again, any person who's going into any competitive sport or if they have any kind of loss of consciousness, any palpitations, all that is important. So if you have any kind of giddiness while changing positions or when you're run around, and youngsters, usually young females tend to have that. When they change positions, when they get up from the bed, they tend to feel a lot of giddiness. That is an EP problem. So if that is evaluated, it is treatable and then they'll be much more comfortable.
How is this evaluation done basically?
So basically we have 3-4 specific tests. Most of them are non-invasive. If the symptoms are very frequent, we will put something called as a 24-hour Holter, which means we're going to detect ECG for 24 hours. Actually nowadays, thanks to all your wearable devices like Apple Watch and all that, you tend to get the same data through that. So that's one way to do.
Is it really the same?
It's not really the same, but you do have an idea as to what is happening. So it is helpful. AF it is detectable. I think Apple is the only FDA approved wearable device for detecting AF. Otherwise, we do a Holter where we look at the ECGs, see if the patient has any other kind of rhythm disturbance during that time. If it is not that frequent, we have something called as extended Holter where we put it for 7 days or 28 days or how many days that is required. Another thing we have is something called as HUT. It's head up tilt test, where we change the position of the patient to see if we can recreate the same symptoms on change of positions and those things. Because usually if your HUT is positive, you don't need many medications. It could just be dehydration or something with your fluid and electrolyte problems, which can be easily corrected without much of tablets. Then if you have a problem and we really see if there is a problem, then you have invasive tests where we do something called as electrophysiology study, where we enter your heart, like how an angiogram is done. Similarly, we enter your heart, stimulate your heart in different areas and try to see if you're having any kind of a specific problem for which you need treatment. And then treatment comes into picture after that. So that is how it's evaluated.